Hi everyone, Dr. Nemechek here. A lot of people ask me, how do you know how to treat SIBO if you don't do a breath test? Because there's hydrogen, they both have hydrogen, or one has methane and one doesn't have methane. You get those results, and everybody's talking about you got to use all these different medicines and so forth. Well, one of the reasons I don't use it is they're notoriously inaccurate, okay? And on a practical level, it just doesn't matter when you have rifaximin, and I want to go over that for you. So what happens when we have our normal gut bacteria, all right? We've got these families of bacteria live up here, and these guys live down here, okay? And we get overgrowth. So you get these normal bacteria in the wrong place. If you just have bacteria overgrowing, that's a hydrogen positive, methane negative test. There is a different organism down here that I don't show in this. I'm just trying to keep it simple in my graphics, but they're called Archaea. Archaea are very primitive forms of bacteria. Even though they're a distant relative, we kind of think of them separately. And if you get Archaea up here in addition to the bacteria, then you get methane produced. And the methane has kind of a like anesthetic kind of an effect on the intestinal tract, and it slows the intestinal tract down in a significant way. So what this one paper here, and again, I'll have links to these papers, is telling us that so a methanogen overgrowth is a Archaea organism producing methogen, okay? And basically what they come down to is these are the people with the most severe constipation, okay? Not all constipation, not intermittent constipation, but if somebody has really, really bad constipation, I'm kind of suspecting they may have a methane overgrowth case, okay? Now, well, one of the nice things is, we've been dealing with this problem of overgrowth for a couple decades, prominently in adults with severe liver disease. Like if you may need a liver transplant or something, you're really, really sick, and you get this, you'll typically die of a thing called hepatic encephalopathy. So there's been a lot of work, a lot of study on this for several decades. Rifaximin is the go-to drug for this condition around the world. Now, many doctors will say, okay, rifaximin or some other antibiotic, they might use Cipro or something, will treat the bacteria, and we need a drug like metronidazole or neomycin. These are two antibiotics that treat the methane producers, the Archaea. Well, that's really not necessary in the vast majority of cases, okay? Because we have other studies telling us that when they go back and look at this, that there is almost no difference between if you have a methane producing overgrowth and you treat them with just rifaximin versus rifaximin and neomycin, that the result is about the same. Okay, so it's for this reason that I don't even need to worry about it. I don't need to do I need a combination or just rifaximin alone? Because the rifaximin seems to be able to take care of it on its own. Now, I will admit, on occasion, and this is, very infrequent, I'll have somebody with really bad constipation, so you're thinking they may have this methogen positive organism, Archaea overgrowth. You treat them with rifaximin, they're kind of better, significantly better, but not all the way better. The constipation is still prominent. There have been times where I've needed then to add neomycin or metronidazole. I tend to prefer neomycin. It makes people less nauseated. So it's not 100%, but on that small outlier group, that's when I'll just give them the combination if the initial doesn't work as expected. So don't get hung up on needing to have the breath test. One, 20-30% of the time the results are wrong. So I've had a bunch of people, breath test negative, nobody will treat me. I give them rifaximin, boom, they're better. Okay. And how do we know they had overgrowth? It's the only thing rifaximin can treat. The only thing rifaximin can do is make this better. Make this go like this. That's it. You can call it IBS with diarrhea. You can call it hepatic encephalopathy. You call it whatever. You just call it SIBO. Rifaximin can only take this and turn it into that. All right? So don't get caught up on the tests. Get your doctor, if you're worrying you have SIBO, talk to your primary about it. Get a script for Xifaxan. That's the brand name in the U.S. A lot of our patients, from what I hear, if their insurance won't cover it, they get it through the Canadian mail order market, and it works just great. So good luck to you all. I hope that helps clear some of this up for everybody. Take care.